It's lovely to see so many of you here today, and welcome to IPE Day and today's panel on climate change, migration, and health. I'm Monette Zard. I'm an associate professor in the Department of Population and Family Health at the Mailman School, and I'm also director of the program on forced migration and health. And I think that the choice of this topic for an IPE Day discussion such as this is really particularly apt. I think all of us who work in the fields of health, as well as in the fields of migration, no matter where on the globe we are going to need to respond to the impacts of climate change in the coming years, indeed, if we're not already doing so in our work. The World Health Organization describes climate change as the single biggest health threat facing humanity, which really threatens to undo 50 years of progress in development and global health, and also exacerbate health inequalities both between populations and within populations. This year's Intergovernmental Panel on Climate Change report notes that we can expect an excess of 250,000 deaths per year by 2050, which will be attributable to climate change, with more than half of this excess mortality really projected for sub-Saharan Africa. Now, the impact of the changing climate on health is likely to be experienced in a multiplicity of ways, both direct and indirect, from elevated mortality and morbidity caused by increasingly frequent extreme weather events such as drought, heat waves, storms, and floods, to the disruption of food systems, an increase in water and vector-borne diseases such as malaria, West Nile virus, and Lyme disease, to then the impacts on mental health, which we are only just really beginning to grapple with and understand. But in addition to those direct impacts, there are also those indirect impacts, and we know that climate change will also undermine many of the social determinants that we know are necessary for good health, including access to livelihoods, adequate social support structures, and the like. Even if the world is successful in limiting global temperature rise to 1.5 degrees centigrade, which is the optimistic scenario, this year's IPCC report notes that 950 million people across the world's drylands will continue to experience water stress, heat stress, and desertification, while the share of the global population that is exposed to flooding will rise by 24%, and every fraction of climate change warming will intensify these threats. And of course, we know that these climate-sensitive health risks are going to be disproportionately experienced by the most vulnerable and disadvantaged amongst us, including women and children, ethnic minorities, migrants, poor communities, older populations, and those with underlying health conditions. Now, on a more optimistic note, the IPCC report also noted that with proactive, timely, and effective adaptation, many risks for human health and well-being can be reduced and even potentially avoided, including through targeted investments in health and other systems, which can reduce the vulnerability associated with climate-related health risks and really enhance the resiliency of some of these systems, however we define that. And yet we know that it is also in precisely those places where climate change impacts will be hardest felt that the health systems are the poorest resourced and where resilience is particularly weak. Now, compounding and complicating this picture is the element of migration. Migrants and internally displaced populations are amongst those groups that we can expect to be particularly disproportionately impacted by the changing climate. Some of the earliest IPCC reports noted that the greatest single impact of climate change could be on human migration. And its 2022 report noted that since 2008, more than 20 million people per year have been displaced by extreme weather events on average, many of these exacerbated by climate and the changing climate. And I think it's important to understand that migration can be in response to both sudden onset weather-related events like floods and wildfires, or it can be in response to slow onset events such as drought and desertification. I think it's also important to stress at the outset that migration in response to ecological change is an entirely rational human response, which has been a feature of human existence for millennia. but all indications are that man-made climate change will introduce a new element into the mix that is likely to disrupt and intensify patterns of human movement, both internally within states and across borders. And I think part of the problem with predicting numbers is that identifying causation really can be a challenge, because we know that environmental effects of climate combine with and exacerbate other factors such as conflict, poverty, weak governance, all of which sort of combine to cause people to move. And I think there's significant gaps in our understanding about what makes people resilient in the face of these challenges, and indeed when and how health and health-related needs get factored into that resilience. So many questions for us to ponder, and we're really fortunate to have with us today a really eminent panel to help us unpack some of these questions and think about what we should anticipate as practitioners working in the health space. Our first speaker will be Dr. Alexander de Sherbinin, who is the Deputy Director and a Senior Research Scientist at the Center for International Earth Science Information Network, CISIN, which is a spatial data and analysis center within the Columbia Climate School that specializes in the human aspects of global environmental change. He also serves as Deputy Manager for the NASA Socioeconomic Data and Application Center and Director of the Climate Mobility Network. Dr. de Sherbinin is a geographer whose research interests focus on the human aspects of global environmental change and geospatial data mobility, climate vulnerability mapping, urban climate vulnerability, population dynamics in the environment, and environmental sustainability indicators. He's published really extensively in these fields and has managed a number of large-scale projects on behalf of USAID, the World Bank, UNDP, just to name but a few. Our second speaker is Dr. Cecilia Sorensen, an Associate Professor of Environmental Health Sciences at the Columbia University Medical Center and Associate Professor of Emergency Medicine. Dr. Sorensen is the Director of the Global Consortium on Climate and Health Education at Columbia University and is an emergency medicine physician, also an investigator in the area of climate change and health. Her work focuses on translating research into policy, clinical action, and education in order to build resilience in vulnerable communities. And her research has spanned both domestic as well as international emergent health issues related to climate change, including heat stress and worker health in Guatemala, wildfires and healthcare utilization in the US, climate change and women's health in India, and mortality following Hurricane Maria in Puerto Rico. She served as an author for the US Fourth National Climate Assessment and serves as technical advisor for the Lancet Climate and Health US Policy Brief. And our third and final speaker today is Dr. Juliana Boll, an assistant professor of population and family health, also in the program on forced migration and health. Dr. Boll is interested in evaluating the effectiveness, efficiency, and impact of health system strengthening approaches in conflict-affected and fragile settings. She's particularly keen on extending the methodological toolkit that we use in health systems research to estimate program and policy effectiveness and impact using observational data and in the application of things like contract theory to improving accountability and service delivery. Her focus really is on understanding humanitarian and development aid programs in fragile and complex settings, and she has experience working in monitoring and evaluation and quality improvement for maternal and child health programmings, particularly in South Sudan. So before we move to the panel, just a word on how we're organizing our time here today. We're going to hear some remarks, obviously, from our esteemed panelists. That will take about an hour and 15 minutes. At that point, we will pause, stop proceedings, give you all 10 to 15 minutes to talk in your groups across your different disciplines about some of what you've heard, to share some reflections and to exchange perhaps some residual questions or thoughts that you have. We'll then come back in a way to the panel, and there'll be an opportunity for Q&A with the panelists at that point. So without further ado, I think I am going to hand you over to our first speaker, Alex. And Alex, I'm going to ask you to help us chart that big picture on climate change, mobility, and what we can expect in the coming years.
Well, thanks a lot, Manette. And I just wanted to voice appreciation to you. I've really valued you as a colleague on the Committee on Forced Migration and also on our smaller climate mobility network. I'll just mention that anyone who's part of Columbia, grad students, undergrad, and faculty are welcome to join the Climate Mobility Network. You can find us online if you Google us. So Manette asked me to set the stage a bit in terms of what we know around the numbers, and the numbers are notoriously slippery and maybe not all that together reliable, but what we found in prior work up to around the year 2010, 2011 was that there were a lot of kind of hand-wavy estimates that were out there. Norman Myers put out a number of estimates around the potential impacts of droughts and other climate change events by 2050, saying 50 million might be displaced, and then he added to that sea level rise with another 162 million by 2050. The Stern report said 200 million potentially affected or displaced by climate impacts by 2050. Some development organizations like Christian Aid came up with much wider and more alarming estimates of up to 1 billion people. And then you have these sort of work that some colleagues did here at Columbia related to sea level rise and the number of people that are currently affected by sea level rise. It was in that context that we worked closely with the World Bank to develop a model. It's a population gravity model, so basically the idea is that people move towards areas of agglomeration historically, and you can actually model that using gridded population data. But what we sought to do was calibrate the model against past changes in relation to climate impacts and then project forward to 2050. And what we found was, you'll see these numbers often in the media, up to 216 million people potentially internally displaced in these countries that you see here, low and middle income countries in the global, what in shorthand we could call the global south. The approach basically looked at future population projections, spatialized projections with and without climate impacts. So by looking at the delta between the climate impacts version of the future world and the non-climate impacts, just development scenario version of the future world, you could actually back out estimates of total migration, sort of cumulative migration. What's important to say here is that the low end is very rarely quoted in the media. So the low end number of 48 million is very rarely stated, which is pretty small. In many ways, might be seen insignificant in a world that's likely to be in excess of 11 billion people in 2050. It's also important to note that under these different scenarios that combine both future development trajectories and emissions trajectories, that under a pessimistic scenario with kind of bad development outcomes, high population growth, low education, low urbanization levels, and high emissions, you get the most climate migrants. So we did not game the model in any way. This is how it fell out, with the pessimistic scenario with much higher levels of climate mobility and the lower numbers coming out under a more climate-friendly scenario with combination of both the pessimistic development outcomes but also much lower emissions. So that's sort of how we did it, and the numbers are much higher in some parts of the world than others. You'll notice that the biggest circle is in sub-Saharan Africa. That is not because, well, by 2050, there will be a lot more people in sub-Saharan Africa than there are today, but as a proportion of population, it also comes out as being a much more significant chunk of the world's displaced and mobile populations. I should caution here, this was all internal mobility. We did not try to model transboundary for reasons that I'll get into in a moment. We have recently updated some of these scenarios for something called the Africa Climate Mobility Initiative. You can go to this website in the lower right-hand corner and bring up a very attractive, graphically intensive website that shows a lot of estimates. What's interesting is the numbers for Africa remain more or less the same. So if you go back to this slide, if you add these two bubbles for North Africa and Sub-Saharan Africa, it comes out to be 105 million. And so The total number is roughly between 46 million on the low end and 113 million internal climate migrants within sub-Saharan Africa. The map on the right shows areas of potential outmigration, so those are brownish areas, and potential in-migration, which would be the greenish areas. And some of the coastal zones you'll see are particularly affected because sea level rise is one of our inputs, but we also consider things like changes in water availability, changes in crop production, and we also look at things like conflict in certain areas of Africa. In terms of one thing that we know is that a lot of people who do leave rural areas will end up in urban areas, and yet you can look at, again, these sort of what will happen, what is the additional or kind of number of people that might be ending up in cities as a result of climate mobility. And those are the purple dots there. In some areas like Ethiopia just jump off the map. Other parts of Nigeria also show quite a bit of urbanization that might be driven by climate change. But some areas on the coastal zone, like in Mozambique and Northern Africa, actually will see declining populations potentially as a result of climate impacts. So this is the kind of narrative that you often have seen or read about in the newspapers or on TV about the potential for climate change to drive massive mobility and migration across borders. And we have actually a project funded by the Department of Defense. Why they're interested, I couldn't imagine, but they wanted to fund research on basic research, basically looking at what are the drivers in these two regions, why are people leaving, are climate factors indeed part of that? One of the things we are already finding by pooling survey data of migrants who've been interviewed from these regions is that no more than about 3% of migrants say that environmental factors actually drove their decision to move. So a very small fraction cite any environmental, whether climate or land degradation or other factors. That said, it could be that some of the climate impacts are working their way through income streams and by driving poverty or other livelihood issues that are in fact impelling some migrants to leave. So it's not that there's no truth in it, but it tends to be overblown by the media, and we'll come back to that in one more slide or two. So what does the research show? Most of the migration will be internal or south-south. One of the things I think that really needs to be highlighted is much more of the migration is likely to be, more people are likely to be trapped in the global south or involuntarily immobile, and this can lead to potentially serious humanitarian implications, and something that we'll be learning more about from our colleagues about what that might mean for the humanitarian sector. The world used to, or the migration world, at least the research world, tended to sort of have this bifurcation between voluntary and forced mobility or voluntary and forced migration. And now we sort of see more a rise of the messy middle of survival, distress migration. Now a term has been coined called mixed migration, which refers to a mixture of different types of migrants and also a mixture of motivations, why people are migrating. And I think it's important to realize that more and more migration is driven by this sort of confluence of factors, and it's very hard to tease out quantitatively what exactly is causing people to move. There is now, I think, important to public health, a growing focus in the climate migration research on lived experience. Things like translocality, the fact that some people use multiple locations like households use multiple locations for subsistence. So you have remittances being sent back to the village to maintain families and homes in the village where people left. There's also an increasing emphasis on the physical and mental health aspects of those who stay and those who go. So sometimes you'll see in the research what they call immobility, IM/mobility, and so they talk about both ends, the people who stay and those who go. And then it's also important to realize there is an element of personal agency, and migrants are not just passive victims, they're also agents in their own right. I just wanted to introduce one slide on the climate justice perspective. This probably deserves a lecture on its own, but basically there's an increasing move in some parts of the literature to tie this to the larger discourse around racial justice, climate justice, and other forms of social and economic justice. Some of the key terms are the term carbon capitalism, which relates to how historical processes of extraction and refinement and burning of fossil fuels and things like that. Many of you know the issues in like places like southern Nigeria where oil companies have held sway, and there have been spills, there have been burning of fossil refining and probably a lot of toxics exposure to the populations that live there, but that happens again and again in many other parts of the world. This concept of sacrifice zones, where carbon capitalism essentially deploys race and racism as techniques for exclusion control, and also this idea of an abyssal line, which is that there are presumptively some people who are allowed to move about the planet freely with their passports and their privilege, and there are those who are excluded from that because they're relegated to zones of violence and dispossession. This is a fairly, obviously strong words, but I found it compelling and interesting to think about these issues from this lens. So from that, what are the sort of policy potential responses if you take that kind of as a basis, this climate justice perspective? One is a national security response, securitization of the borders, increased border patrols. Another might be this humanitarian response where you're really taking care of both those who are in transit and those who are kind of stuck in place, trapped, as I called it earlier. This is kind of climate adaptation as a form of charity, but it doesn't really address the historical legacy of the emissions of the global north or the responsibility for some of those emergencies. So it's kind of like, well, we'll give you some money out of our largesse, but doesn't really address the moral sort of imperative. Then migration management is this idea that climate migrants are entrepreneurs who are actively adapting to changing circumstances, and all will be well if we just facilitate their migration or help them to get to the urban area, but God forbid they might actually choose to come farther north. Finally, there's this kind of approach that Gonzalez argues for, which is a self-determination or a just approach, where collective rights of displaced persons have a right to self-determination and legal continuity as self-governing communities where they, in place, or if they choose to move, also in the locations where they move to. So I just want to leave you with some of these sort of implications of these different lenses, and with that, I think, did you want to engage in a little bit more of a Q&A?
Well, I think you've laid the groundwork so well. I think I'm going to move next to Cecilia and move on to laying out the health, and we'll come back to you. Yeah.
Sure. Make sure this mic is working. Yeah? Test? Okay, awesome.
So Cecilia, can you tell us a little bit about what we can anticipate in terms of the health impacts of climate change, a little bit of the direct and indirect impacts that I described earlier?
Yeah, absolutely. But I want to start with some audience polling. So raise your hand here if you feel like climate change is affecting your health or the health of someone you know. Just a quick raise of hands. Okay, great. And raise your hand if you think that as a health professional, you need or you are going to be faced with patients or communities that you are tasked to take care of who are going to be impacted by climate change. Raise your hand. Wow, okay. All right, so you guys are really aware of things and really with it. So I might not need to go into too much detail here, but I will. I don't know if this is working.
There you go.
Yeah, okay. So when we think about, oops, I went too many slides. There we go. So when we think about the health impacts of climate change, we start by thinking about exposures. So exposures are those things that are becoming more common or frequent as a result of climatic factors. So exposures we see here are things like extreme heat, heavy precipitation, changes in vector equality, impacts on water and food, degraded environments, etc. Now, as a result of exposures, there are many potential health impacts that could result from them. So for example, if we see impacts from extreme heat, we can see more people getting heat illness, more people getting cardiovascular disease or respiratory disease. Now, what's important to know is that none of these exposures are affecting a population in isolation, right? And I think a lot of our work to date has really been like, well, what's the impact of heat on human health? Well, the reality is that we're often exposed to not just extreme heat, but also to air pollution and also to a pandemic, right? And so we're at this point where it's not just saying, okay, there's one exposure which is facing a population. There are actually many different exposures which together act on a geographic area or on a community. Now, this diagram I think is great, and I love that the wheel spins, but I think it oversimplifies some of the work and some of our understanding in this space. So for example, when we look at, for example, water quality impacts, we see that potential health impacts could be cholera, cryptosporosis, campylobacter, leptospirosis, harmful algal blooms, right? Those are potential health impacts. But it doesn't necessarily mean that those are going to be the health impacts that occur, because each individual and each community has a different vulnerability to actually experiencing health impacts. So for example, if we're thinking about degraded air quality, if you live in a place that's very, let's say, rural, and you don't have a lot of heavy traffic nearby your house, well, maybe your air quality is actually pretty good, so that's not going to be a big issue for you. But if you live in a city and potentially in a poorer neighborhood where you have heavy truck traffic every day and you're exposed to a lot of heat from urban heat islands, the impacts on you are going to be quite a bit more, right? So despite the fact that we sort of see all these potential impacts, it doesn't mean that everybody is going to experience the same impacts. It's going to be mediated through a lot of social factors, a lot of structural factors, and a lot of geographic factors. And so what the work of people like myself do, I'm an emergency medicine physician by training, and now I'm in the School of Public Health. Somehow I got here. I'm odd everywhere I go, but I think I'm a climate physician, is to really try to understand how these different exposures are linking to health outcomes. And further, what can we do as health professionals to try to buffer these impacts using and deploying the full set of skills that we have? So I just want to give a little example here as we're talking about, there's a lag. Let's try again. We have to point it somewhere. Maybe just next slide. There we go. So I think this is a really good example of what Alex was talking about in terms of internal migration. And so here what we're looking at has been called the Katrina diaspora, right? So in 2006, there was a huge hurricane that hit New Orleans, right? And what we're seeing here is data which are FEMA claims of people who left New Orleans. So as you can see, people went everywhere. They even ended up in Alaska, okay? People went everywhere. And every time there is some type of climate-driven extreme weather event or exposure that's affecting a population, people will adapt. And migration is an adaptation mechanism if you have the resources to do it. Now, what we learned from Hurricane Katrina is that the most severe and fatal health impacts occurred among those who couldn't migrate, right? Those populations who became trapped. So these people here are represented. These are survivors, right? These are people who were able to leave the exposed area of New Orleans. Now, what we found afterwards, after Hurricane Katrina, is that it was the direct impact of the extreme weather event that led to a lot of health systems shutting down. Dozens of hospitals had to be evacuated because they were flooded and they had their generators in the basement. Try evacuating a NICU in the midst of an oncoming disaster. Really, really dangerous, really, really scary stuff that nobody had really planned for, right? Then in the aftermath of the disaster, we saw that there was an increase in vector-borne diseases because there was all this flooding in the area. There was actually, I think, 10 times the rate of West Nile virus infections in the flooded areas of Louisiana because there was so much standing water, right? So then you get an outbreak of vector-borne diseases. We also saw a lot of chemical and industrial spills in the aftermath of this. And then we saw that there was a very vulnerable worker population that showed up afterwards to do the very dangerous and hazardous cleanup from this. And so there's so many layers that go into it. And so long after media attention has turned away from one of these disasters, the communities continue to experience impacts. Follow-up studies from Hurricane Katrina have showed that mental health impacts were rampant afterwards and persisted even 5 years later among affected people in this area. Other research looking at pregnant women found that those women who were exposed with a high level of vulnerability to Hurricane Katrina suffered increased birth complications, such as preterm birth, small for gestational age babies, and other types of pregnancy complications. So the impacts are myriad, and with every exposure, we see what happens in communities, and we continue to learn from this. The other thing I want to show you about this map is that, I came from Colorado to New York, and I'm sitting there in Colorado being like, phew, well, good thing we don't have to deal with at least hurricanes. But the reality is look how many people left New Orleans and ended up in Colorado. There were plenty, right? And these patients are coming to seek care, right? They oftentimes have missed dialysis. They don't have their insulin. They don't have essential medications, and they definitely don't have their medical records with them. And so no matter where we practice, no matter what communities we work in, we are going to be taking care of the health of people who are migrating away from climate emergencies and other types of emergencies that we're facing. Next slide, please. Oh, wait, it worked. Hold on. Okay. So this is sort of a quote that Monette talked about, which is that the severity of climate-related health risks is highly dependent on how well health systems can protect people. So I see this as our silver lining. I see this as an opportunity amongst a lot of really, really difficult and challenging news that we're up against related to the impacts of climate change on health. We, according to the IPCC, and this is a statement that was made with very high confidence, we as health professionals, we are the first and we are the last line of defense in many ways, right? The impacts are highly dependent on how well health systems can protect people. What's a health system? A health system is us. We are health systems, right? We are nurses, we are physical therapists, we are public health professionals, we are nutritionists, we are dentists, we are doctors, we are healthcare administrators. We are the health system. So our ability to buffer these impacts to vulnerable populations is really going to determine what the ultimate health impacts are. Now, the interesting thing about this is that research has shown that the more we are able to reduce vulnerability and build the resilience of our health systems, the more money that we save. So for example, one of the questions is sort of around, we're seeing disaster after disaster, right? NOAA actually tracks the numbers of billion-dollar climate and weather-related disasters every year. In 2019, there was something like $500 billion of just infrastructure and property damage alone, right? That's not even beginning to account for health impacts. And so the reality is that the costs of these types of disasters are mounting and mounting. But if we build resilient health systems, that means that our hospitals are ready to deal with disasters, that our professionals are trained to diagnose and treat climate-related emergencies, that we have the opportunity not only to protect the health of our populations, but also to prevent these massive economic harms, which are spread across our social system and also shared across our communities. So the way I kind of see this is that each profession represented in this room has a very unique role to play. So for example, as nurses, you guys are the #1 most trusted profession, again and again in Gallup polls. Everybody trusts nurses more than doctors, more than pharmacists, more than lawyers, more than judges, more than anybody. You guys have the trust of the public. And so when you're educating your patients and you're talking to them about their risks and what they can do to protect themselves, you can give them evidence-based guidance on how they can buffer the health impacts from affecting themselves and their loved ones, right? Dentists, people talk to you about all kinds of stuff, right? You also have the opportunity to do counseling. Physical therapists, nutritionists, we all have this role where people trust us and what we say. Now, we each have a sort of unique role in that. We also have this ability to come together as a group, right? So oftentimes we see ourselves as being employees of a larger health system. But we make up that health system. And when we come together, we have the opportunity to change business as usual practices, right? So we know right now that if taken together, all health systems across the world, if gathered together, they would together constitute the 5th largest emitter of greenhouse gases on the planet. So in addition to doing a ton of good in the communities we serve, our health systems are doing some harm. We are a carbon-powered type of operation. And so we have the ability to articulate to leadership. Maybe we will become leadership. The benefits that we will see in our communities and to the future of our children if we work to decarbonize our health systems and to build a more resilient type of structure in our communities. Because what we see time and time again is that health systems become anchor institutions during climate-related emergencies. People run to hospitals, right? Sometimes they need medical care, sometimes they just need to charge their phone, sometimes they need information, sometimes they need water, but they come to health systems, they come to us. And so we need to make sure that our health systems are highly resilient. And so a lot of the work that I do is based out of the Global Consortium on Climate and Health Education. So we are an organization of over 300 health professional schools in 56 different countries who have pledged at the level of the dean to train their students in climate and health. And so I'm happy to report that the schools of nursing, dentistry, medicine, and public health here at Columbia, your deans have also pledged to ensure that you are trained in climate and health. So there's a lot of curricular development going on right now that's rolling out. I also want to give your attention to the fact that there's a new student group on campus that is formed, which is called Healthcare Students for a Sustainable Future. So if you're interested in getting involved on on-campus activities, I think there's a way that you know how to find this group. So Healthcare Students for a Sustainable Future. There's a lot of great students who are doing a ton of advocacy work and working to change your curriculum. And we have a ton of events to help you increase your education through the Global Consortium, and I'm happy to share those with you. We also have an interprofessional course, which we just launched this spring, and hopefully we'll be running again next year. So with that, I'll turn it back over to you, Monette.
Great. Thank you so much, Cecilia. So we've had the table laid for us in terms of mobility impacts, health impacts, and a sort of call to action in terms of the potential for building more resilient health systems and more sustainable health systems. I'd like to turn the floor now over to Dr. Ball to tell us a little bit more about how some of these factors play out in the regions she works in, you know, where we have health systems that are already struggling under the weight of hosting large numbers of refugee, conflict-affected populations, and really beginning to help us think about how some of these challenges are felt and responded to in these fragile and conflict-affected spaces as well.
Could I get some help? I thought I would start by really talking about the scale of the problem, right? So how many people are actually forcibly displaced today? And as of mid-2022, the United Nations High Commissioner for Refugees estimated that about 103 million people are displaced. These are about 33 million refugees, including 6 million Palestinian refugees who are under UNRWA, which is the United Nations Relief and Works Agencies for Palestinians for Palestinians in the Near East. It includes 58 million internally displaced persons in 34 countries, including 5 million asylum seekers. We have what we call durable solutions, which aim to address the issue of forced displacement, and these solutions are not keeping up with the scale of the problem. So last year, about 42,000 refugees were resettled in a third country. Another solution we have is repatriation, where people voluntarily return to their countries of origin. So last year, about 1.4 million people returned to the Democratic Republic of Congo, Central African Republic, Myanmar, Syria, the Philippines, Afghanistan, and South Sudan, among other countries. And so I think, and I think we can talk about when it comes to the issue of asylum seeking, that narrowing space of countries willing to host asylum or even accept asylum applications, including the United States and the United Kingdom. So in my opinion, there are kind of three critical, I'm terrible at technology. There are kind of three critical areas where people who are forcibly displaced are affected by the issue of climate change. And the first one is really looking at where refugees and internally displaced persons currently reside. And they primarily reside in places that are vulnerable to climate change. So 74% of refugees are hosted in low and middle income countries. These are countries that include Uganda, Ethiopia, Chad, the Democratic Republic of Congo, Pakistan, Bangladesh, Islamic Republic of Iran, Turkey, Colombia, Lebanon, Bulgaria, and Tanzania, Yemen. I mention these countries because if you look at countries that are vulnerable to climate change, these are the names that keep coming up. So they're hosting a large number of refugees and internally displaced persons. They are potentially going to be sources of additional migration now and in future. And they're exposed to issues of climate change. These countries are also affected by conflict. So this is another additional layer, and climate change is acting as a threat multiplier. So if you look at, for example, some of the largest United Nations peacekeeping missions, about 10 of them are in places that have been identified as having, as being highly vulnerable to climate change. There's a mission in Haiti, in Western Sahara, where we have the Sahel region, which is very, very vulnerable. There's a lot of migration and conflict already happening in the Sahel. The mission in Mali, again, Democratic Republic of Congo, Iraq, Yemen, South Sudan, India and Pakistan, Libya and Somalia. So this has implications not just for the effect of climate change on, potential effect of climate change on additional or new conflict, but also on whether or not we're able to maintain peacekeeping operations, including DDR, which is demobilization, disarmament, and reintegration, which relies on providing alternative sources of livelihoods for people who had been involved as members of a militia or an army. And the last point I wanted to make about where people who are forcibly displaced reside is that they're also in places that are least likely to get climate financing to adapt or to mitigate the effects of climate. And I won't mention the countries because I'm going to be repeating myself, but the United Nations Development Program, UNDP, in 2021 estimated that extremely fragile and fragile settings receive about $9 per capita to adapt to climate change. If you break that down, it's about $2 for extremely fragile countries and $10 or $11 for fragile settings. This compares to about $162 for non-fragile settings. So you can see sort of that big gap in funding. So that becomes another additional problem. You fled because of conflict, you fled because of disaster. You're in extremely vulnerable populations. I like this map because I grew up in Kenya, and this map kind of shows, it's dark because it shows that these are areas that are very vulnerable to climate, and I have mentioned them several times. But if you look at Kenya, for example, the darkest red in the north, that's where the refugee camps are. And if you go across very many places, Jordan, etc., and look at where the refugee camps are actually hosted, they are in these margins, the margins of society. So that's, gets you thinking, before you even start talking about the health implications, it's talking about economic livelihoods, it's talking about, does your shelter protect you from extreme heat or flooding? We had flooding in the Rohingya camps in Cox's Bazar in Bangladesh, etc. And I would say that the humanitarian sector is not necessarily prepared to change how we do things. So if you're offering tents to people, and we know that forced migration, it's not temporary, it often ends up being protracted. So if our solutions to that is temporary, what does that mean in an environment that has been described by all of us? And the third point I wanted to make is that there's a very limited regulatory framework governing this type of migration. In the previous slide, if you noticed, Venezuelans are considered under special international protection. They're not considered refugees or internally displaced persons. And that is because most of them are moving for reasons of economic and livelihood opportunities. So we do not have a legal framework that governs moving because you cannot sustain your livelihood where you live. The UN Convention defines a refugee as somebody who crosses a border for reasons of persecution due to race, religion, nationality, politics, or being in a particular social group. It has not been revised to say migration due to natural shocks and disasters, or migration for economic opportunities. I think one of the first mentions of displacement due to natural disaster or human-caused disaster is from the Kampala Agreement, which is the 2009 African Union Convention that looks at protecting and assisting internally displaced persons. But again, that does not address people who actually cross the border. At the United Nations level, I think we kind of see, Monette has a really good phrase that she used once, and it kind of stuck in my head, and which says that the legal environment is moving at a glacial pace. At the UN level, there's a lot of talk about ensuring greater cooperation to protect people who are fleeing due to forced migration. There's talk of enhancing our understanding on this particular issue. The 2015 Paris Agreement, does what we do when we want to not deal with an issue, which is create a task force to come up with recommendations. But out of the task force came the Nansen Initiative, which is a consultative process that state governments come together and try to come up with best practices to address the issue of forced migration and how to protect people who are fleeing due to climate-related disasters. And that's where we are, the legal sort of environment. So I think these are the key issues that really, when we think about climate change and people who are moving involuntarily, I think these are the three key issues that we are talking about. And then I wanted to maybe look at, we talk about building resilient health systems. And WHO talks about this as being one that can anticipate, respond to, cope with, and adapt to climate-related shocks. I really like this framework because it builds on the building blocks of a health system. Hopefully you're all familiar with it, but it sort of tries to operationalize what a resilient health system would look like. And I'm not gonna go through all of it. I'll just focus on what I'm calling some of the opportunities and challenges, but I also look at the challenges as being opportunities. And so I thought the first challenge is leadership and governance. And I think we see this not just in health, but in our failures to address the issue of climate change, having the political will. In the health sector specifically, it means also having leadership to actually bring together all the different health sectors, reorganizing ministries of health to ensure that the environmental department, the vector control department, the disaster response department, the health information systems are adapting and collecting information on climate-related disease events, as was mentioned by Cecilia. And also cross-sectoral collaboration. We would need to collaborate with the Ministry of Agriculture to ensure that our food systems are secure or provide adequate nutrition. We would have to cooperate with municipal systems to ensure that water and sanitation is not compromised when there's a flood or when there's extreme heat. And the built environment as well, ensuring that we are building back better, or not back, just building better. Looking at making sure that our buildings are resilient to extreme heat, as I mentioned before, to flooding, health facilities as well. Cecilia went and talked about the health workforce, and I think the fact that, if you are receiving health training as a health worker and that is not focusing on issues of forced migration and how this affects health, what is the immediate response during a disaster? What are the priorities? Water and sanitation, for example, vaccination, ensuring that children under 5 are vaccinated, food, and what does an adequate food basket look like, etc. Then we are not really addressing resilience. We are not really adapting to the issue of climate change. So I think even as doctors, nurses, midwives, making sure our training is focused on not just now, but the future. I see that as a challenge, I see that as an opportunity, I see that as a huge challenge in the context I work in. For example, in South Sudan, our health system is built on the primary healthcare sector. So we have nurses, nurse midwives, clinical officers, community health workers, and as you go up the funnel, I didn't mention doctors because we have a huge shortage of doctors. As you kind of go up in terms of training and experience and expertise, you have fewer and fewer of the health workforce. And as mentioned, we might have an increase in the demand for health services because of all the climate-related issues that have been discussed. And so are we ensuring that in future we not only have adequate health workers to address the health needs, but also that we can deploy health workers in case a disaster happens? And I think talking about also health infrastructure, I think we talk about sort of building climate-proof health facilities, and I won't go into it too much because you spoke about it so well. But yeah, I see sort of those are, and surveillance systems, right? So and I think living in a COVID environment and having gone through the experience of COVID-19, I think we begin to understand the importance of surveillance. Knowing where there's, the huge breakouts of diseases, that is going to continue to be increasingly important, not just in the developing world, but I would say the developed world. Talking about, really modeling where mosquitoes are traveling to, because mosquitoes are a big problem, malaria, dengue, etc., and how this is what implications this will have for populations. And also having a health workforce that can engage with the community to not just respond, but to also prevent future issues around climate change. Let me see, what else did I want to talk about? I think, and I think another opportunity is really some of the technological advances. I know we talk about technology, hopefully technology will save us. But there is an opportunity to, as we say, really develop, and we think about this graphic assumes one thing. It assumes a static health system. So you go to a health facility. If you're talking about forced migration and displacement, we might have to start thinking innovatively about a mobile health system. The population is moving because of, some of the extreme shock, some of these extreme weather events. The health system might need to be capable to move with the population. And how can we innovatively design models that actually allow us to do that? I think it's going to be really, really critical. Thank you.
Great. Thank you so much, Juliana. What I love about this panel is they've laid out the challenges, but they've also laid out some very thoughtful ways in which, the world and health practitioners can help the world adapt to some of these challenges, whether it's in the area of building resilient health systems, building resilient lived infrastructure and social support systems, or even thinking about, God forbid, the reform of the way we manage mobility at the global level. So some big ideas that are out there. We are running a little bit over time, but I did promise the organizers that I would give you all some time to talk in your small groups. So hopefully you're all sitting in the right color-coded chair that allocates you to the appropriate school, and you should be in groups of 4 or 5. What I'd like to do is give you no more than 8 minutes to turn to each other and perhaps share with one another some thoughts and reflections that these panelists have elicited in you this morning. Just share a little bit, what you're thinking about as you listen to these presentations. And then we're going to leave at least, we'll have about 20 minutes for Q&A. So you can also be formulating any questions that you have for your panelists when we come back in 8 minutes. So it is now 12:27. So if you could turn to each other, I will give you 8 minutes. And then do please listen to me when I call the room to order and ask you to line up and ask your questions. All right. finish up your thoughts. All right. Great. Well, that sounds like you were all having a very lively discussion, so I'm very, very pleased about that. Now, you'll have noticed we have 2 microphones. We have one down here. We have one up there. So, the floor is now open for you to ask any questions that have either come up during the course of the panel or in the course of your small group conversations. We have about 15, 20 minutes to answer any questions that you have. And while you're mulling them over and coming up to the microphones to ask them, don't all rush at once. I actually have a few questions that certainly came to mind as the panelists were speaking. So I will ask them, but please do rush for the microphones and come and ask your question of the panelists. So one of the questions that I had actually was prompted by something you said, Alex. You talked about the challenge of narrative in this space, and particularly when one is dealing with modeling and numbers. My question really is, how does one hit the sweet spot in how we present our science? Presenting the science in such a way that it elicits constructive responses of the kind that we've been talking about, sort of responding through building more resiliency, adapting the way we teach, thinking about our mobility systems. And how do we ensure that our science is not used to close the doors, as it were, to migrants, or to elicit a more fearful response or a more negative response on the part of policymakers? So it's addressed to you, Alex, but Cecilia and Juliana may also have some thoughts.
It's a great question, and I've become part of the way I present the numbers is to try to give some nuance, whereas the media often loses that kind of nuance. But there's definitely, I got an invitation about a year after Groundswell was released, the initial version, by the Hungarian government. Well, if you know anything about the Hungarian government, you'd know perhaps what was behind and motivating their desire to have me come, which was essentially a conference against migration to Europe by a lot of conservative thinking people who felt that the numbers, already were too much. There was, prior to that, of course, the paper out of Columbia University, for better or worse, on Syria, which, described the potential contribution of the drought. It was a Proceedings of National Academy of Science, so a very high-profile article that essentially looked at how a major drought preceded the conflict, which then led to the mass migration flows. They weren't saying the drought caused the conflict. They just said there was this drought, and maybe it was somehow contributory. And so there's been, through media reporting, and other means, I work with a guy named Abram Lusgarten. You saw the article, or the New York Times Magazine cover that I put up there, and I actually discussed with him some of the work that he was planning for that. I don't think they get it wrong necessarily, but I do think it does run the risk of securitizing the debate. On the flip side, what we found is that having numbers in the Africa context, at least under this recent climate mobility initiative, has helped open doors, and I defend the work that we do in part because the numbers from Groundswell have really gotten this on the map in a way that if you just produce more journal articles in an academic environment, you'll never really reach that level of penetration in terms of awareness that this could be a major issue and that we need to start planning today. And so the Africa Climate Mobility Initiative has really, I think, done a fantastic job of doing regional consultations, engaging youth, engaging different organizations throughout the continent. And so I'm more hopeful that there will be good outcomes in some ways from that initiative as a result of their follow-up.
Thank you. Any thoughts from the rest of our panelists? I want to see someone rush for the microphone while we're having those thoughts. Don't be shy.
Oh, we'll just keep droning on and on and on, and you don't like that. Trust and believe. On the issue of narrative, and I really never really liked the images of migrants on the Mediterranean Sea and the stories that come around that, because migrants in the Mediterranean Sea, or migrants everywhere, are making an informed decision to go to places where they can maintain a livelihood and support their families. And so I think the issue of the single story becomes really important. What kind of stories are we saying, or are we talking, or are we prioritizing when we talk about migrants? Alex mentioned the issue of agency, and so making sure that even when we are narrating people's experiences, we're not taking away their agency, because, you know, as we saw with Katrina, climate change does not, I mean, the natural disasters, you know, most of us are vulnerable to natural disasters, and we do not know how we're going to react to them. And so if you look at some of the natural disasters that have happened, some of the narratives, the media narratives that come out of that are often quite, I would say, awful. Haiti, Katrina, and other places. So making sure that we're not taking away agency, and we're also essentially ensuring that we're talking about the complex decisions people have to make when they're faced with certain situations. Thanks.
Thank you. Well, we have a queue. I love this. So please go ahead. Question from the floor. Let's take 3 at a time, and then we'll have the panelists respond. So please say which school you're part of and your name.
Sure, I'm part of the School of Social Work. And my question is a bit tangential, and we were not sure if we should ask this question, but we're going to ask it anyway. So we are concerned a bit of the impact of pollution. So all the plastics that is happening, you know, that are gathering up in the islands, and all the medical equipment that sometimes might be floating along with that plastic. And so the impact on all these communities and how those are connected as well to the whole migration. Just way of example, I worked in Chad, and I saw at moments where people would have to dig about 1 meter down to actually have access to water. The opposite of that was when I worked in East Timor, with the flood of water was just really damaging people's property and in agriculture. And so those are 2 different examples of climate change. Thank you.
Thank you. Let's take the second question.
Sure. Down. Hello. I'm Robin. I'm currently in the School of Nursing. I also have a background in working in public health. And I thank you, panel, for your comments today. There was a brief comment at the end about, as practitioners and as healthcare professionals, working not only in the treatment side, but in prevention also. And I was wondering if you could dig a bit more into that. I especially appreciated the graphic at the end that showed the different components of a resilient healthcare system, and trying to pick apart, there's the service delivery, where can we as practitioners really help in the prevention, not in addressing climate change, the bigger issue, but sort of this in-between ground of, addressing climate change and treating patients. There's sort of in-between middle ground. Where can we kind of contribute to help prevent some of the worst effects of climate change that we're seeing on our patients and communities? Thank you.
Great, thank you, very clear. So we'll take a third question and then give it back to the panel.
Hi, I'm Gabby. I'm a medical student. My question was in regards to the comment about building better and incorporating climate resilience. Prior to medical school, I worked in global health, and there was a lot of talk about the bifurcation of humanitarian assistance and international development, and how there needed to be a push to better integrate the two. And I was curious to hear your thoughts on how and if that's happening, and how climate resilience is being incorporated into that work on a global context.
Great questions. So we have 3 questions on the table. Cecilia, I feel like I want to come to you for the first one and also for the second one to at least get us started off.
Sure.
So the impact of pollution, and what more can we do in the area of prevention?
So, yeah, the question of pollution is a really big one. And I think when we're thinking about climate change, we can't lose sight of the other environmental issues that we're facing, right? Climate change is one of them. We're also seeing issues with pollution, with biodiversity loss, and so on. There was a study that came out of the Lancet a couple years ago. It was the Lancet Commission on Pollution, which suggested that pollution is one of the leading causes of death in low middle income countries, exposure to industrial toxins, et cetera, et cetera. So, I think it's the plastics, it's the microplastics, things we don't know much about, but it's also, I think, things that we do know quite a bit about, right? And thinking about, how do we use our voices as health professionals to advocate for better industrial standards in terms of waste management of the health sector and also of sectors outside of health. So thanks for bringing up that point about pollution. I think it's really is part of the big environmental challenge that we're thinking. The thought about prevention, I think, is a really, really big one and a good one. And, every time you have a framework, they break it down into building blocks, and then we run into trouble, because the reality is that everything needs to be connected. But in order to sort of dissect it and understand what the parts are, you have to sort of separate it, and then we run into silos, and then, so there's definitely some artificial sort of breaking apart of different actions, but really we need all that sort of interdisciplinary, we have to connect those blocks so closely. And, I think, the question was from sort of the nursing, from our nursing colleague, thinking about, what role do we play in prevention? And, the way I sort of see us working as health professionals is we have tasks that we need to do for primary prevention, secondary prevention, and tertiary prevention of events. Now, unfortunately, we really focus on tertiary prevention, right? Like once there's been a disaster, okay, well now we've got to go deal with it, right? Which is the most expensive way of providing healthcare, right? And we need to be sort of focusing on primary prevention, on public health measures. And beyond public health measures, what are the primary prevention actions that each different health profession can take, be that advising patients who are potentially vulnerable, right? So if you are counseling, women who are pregnant who have young children at home, what advice are you giving them about exposure to heat, exposure to vector-borne diseases, exposure to air pollution, right? We have an opportunity there to do primary prevention, both at the level of just the individual patient, but also on the level of system-wide change. And so I would urge us to sort of, we have to sort of dissect things and put them into blocks to think about them, but as we go into practice, we really need to be getting out of our silos and having a more sort of holistic approach to this.
Great, thank you so much. And Juliana, I'm coming to you for the question
Shaking.
about where does climate resiliency fit in the humanitarian development nexus? And I'm sure, Alex, you may have some thoughts on this as well. But
I'm going to speak a little bit first about what the health workforce can be doing to prepare for the future, because I think one of the things that has become important is understanding the issues of forced migration, because it's going to happen internally, it's going to happen externally, and you're going to be the first responders. So understanding what are some of the priority areas you need to address a Katrina-like situation if it happens where you are. I think we need to figure out health education, and I think COVID has shown us that we might not be really good at talking about prevention, safety, et cetera, et cetera. So figuring out health education and community engagement, because that's going to be very, very critical. Now, coming to this bifurcation of humanitarian and development, and we have a lot of terms thrown around, the humanitarian development nexus, et cetera, and thinking about climate resilience and climate resilient health systems. In my opinion, I think it's kind of like looking at issues of climate change and mitigation, et cetera, et cetera. We have a lot of how we can do things and how we should do things. The issue is, how do we operationalize this? So I do not know where we have actually started to build a resilient health system. We have very many examples of things we could do. If you think about health workforce training, if you're close to graduation and you haven't addressed climate change and health in your classes, that should say something. If we're thinking about, climate-proof health facilities, do we have examples in place? Are we innovating, looking at, given, for example, the example of Katrina, are health facilities and health units moving with populations? Because that's going to be critical. So I think, one of the issues with the humanitarian sector is that it takes a very short-term approach, even though we've known for decades that displacement is long-term. So the funding tends to be short-term, and the split with development is that with the development actors, they tend to look at the longer term. As I mentioned before, there's quite limited funding for climate adaptation, especially in the areas of greater need. Part of it is because of the verification mechanisms that sort of govern whether or not you receive this funding. So I think there's still a lot of work to do in terms of taking, this framework to build climate resiliency within the health system and actually operationalizing it on the ground, including looking at the health workforce, health infrastructure, health information systems. We don't have systems in place to actually monitor or capture the data on climate-related disease events, on what happens when vectors expand their geographical foci. Malaria, for example, is becoming a bigger problem in Nairobi, where I grew up, where it wasn't before. Are we tracking that and attributing that to climate? That's going to be important because we need the evidence, as Alex has mentioned. That's how I could answer that.
Great. I'm conscious we have quite a long line, but anything to add, Alex, on that? No? All right, so we have 8 minutes left. So I think I'm going to take 5 questions in one shot. I'm going to be brave. So please go ahead, and then we'll make sure that we get an answer for you before the session's over.
Thank you for this very interesting panel. My name is Emma. I'm a second-year medical student. I'm currently doing clinicals at a small hospital in upstate New York that's very under-resourced and understaffed for even the immediate needs of the community today, let alone these really important issues that you've brought up. And so I was curious, in a setting like that lacks the resources we have here in New York City, what you all would like to see being done to improve the ability of the system to meet these needs related to climate change and migration.
My name is Ben Perlstein. I'm a chaplain in the Pastoral Care and Education Department here, and I'm sitting with a lot of probably the existential terror and dread and all other manner of suffering that's in the room and in this conversation. And I guess there's a lot of questions I have about what culturally humble and attuned accompaniment would look like for the particular populations that we're talking about, but also for the whole kind of gestalt of humanity as we try to connect enough with like how this really is all about our relationship with life and with each other, and what's most important, and also with the things that cut closest to our hearts and to pain that is really intolerable in a certain way. And I'm curious, there's a lot of questions and ways that I would love to just hear more of how you think about these things, but also in your work as people who are, I imagine, sort of walking a fine line in terms of your own internal experience of how to engage with this material in a way that's really helpful and not overwhelmed, but also that's open and connected. What you would say about how spiritual care providers can sort of attend to some of the spiritual pain that might be part of what it means to be human at this time. Thanks.
Thank you. Such an interesting question. Yeah.
Hi all, my name is Adela and I'm a social work student. I'm in the policy track and also the international social welfare field of practice. And my question is regarding political will. When we were looking at the framework for the climate resilient health systems, under leadership and governance, Juliana mentioned specifically political will. And before I came here, I was a policy analyst for the governor of Jakarta in Indonesia, and we're famous for our sinking city. And one thing that I learned was that even though it was so urgent, but at the same time navigating the public who understand, the severity of the problem, other political institutions who we need their cooperation to address the issue was extremely difficult. So when I was looking at the map of those African countries, my question was, there are so many countries who still deal with conflict, socioeconomic problems, and on top of that, they have their own national priorities, right? So how in your work have you struggled to communicate the importance of climate change and also migration when they themselves perhaps don't even have the funding to address that?
Whew, that's a big one. They're all big questions. All right, please go ahead.
Hey, my name is Nipendra from Biomedical Informatics. And I was wondering, we talked a bit about like limited regulatory frameworks and the example of Venezuela. I was wondering how and where we account for like the millions and soon to be tens of millions of labor-seeking migrants, particularly in the kafala system from places like Nepal, Bangladesh, Sub-Saharan Africa, and North Africa. And like, are they included in the groundswell projections? And how do we build a narrative around that? Thanks.
Okay, last but not least.
Hi, I'm a current dental student, first year, and my question, one of my questions was kind of addressed about like just how to navigate burnout in climate activism. I forget who asked that, but another thing that I was just wondering was like, how do you, like, what are the steps to hold just our healthcare industry itself more accountable for climate change? Like, let's just say pharma, especially in situations where, like, let's just say our whole like political system is based in lobbying itself, and like the challenges to navigate that.
Great, wow. Do we have another 2 hours? Can we extend? So in the interests of time, I think I'm going to try and allocate some of these questions, but don't feel constrained if you do want to weigh in on any of them. So I think on this question of how to navigate burnout and how to hold the healthcare system accountable, I'd love to turn that to you, Cecilia, as well as this question that was posed right at the beginning of what more do we want to see in health systems like the one upstate that's already under-resourced, where we'd want to see greater attention to climate adaptation. So if you could take those in a way, 3 questions, that would be great. I have to say, Alex, I feel like I'm drawn to you on the question around spiritual care and really thinking about how you, in a world dominated by numbers and modeling, how you think about the human beings at the center of your work. And I know that's something you've really thought about deeply. And when Juliana, sorry, I'm coming to you on the questions around political will and governance. You can go last, so you have time to think a little bit about that. The exception there is, of course, what do we do about and how did Groundswell deal with the labor-seeking migrants? So you might want to chime in on that as well, Alex, so seeing as that's specifically about Groundswell. All right, so Cecilia, shall we start with you?
Yes. Can you remind me of my questions?
Okay. So your question was how to navigate burnout.
Yes.
How do we hold our health systems accountable in a more sustainable response?
Yeah.
And then what more do we want to see?
Okay.
Very quickly, in like a minute and a half.
Yeah, for sure. I'm really glad we have chaplains in the room, because you guys always show up at the most painful moments of any situation. So thank you for sort of sharing that perspective, right, of kind of that zoom out of like, this is really, really difficult material that we're dealing with. And, I sort of say, in the face of pain, we can't look away. And I think especially as health professionals, we cannot look away from this issue, even though it is painful. And so how do we bear that pain that we feel when we hear these types of information and these numbers? And I say it's because we can bear the pain together, right? It's because we all in this room sort of feel that this is an emergency. We feel this crisis. And so I urge you to talk to each other about it. They say talking about it is really the best way, is to share what you're experiencing. I would also say that, action is the antidote for depression, right? And so, don't go into a room and start Googling things alone, right? Not a good strategy. Talk to your friend, and then think about, what you can do together. What is within your grasp? Because what this is going to require is transformation of our systems, of our governments, but also transformation of ourselves and what we can do. And I think that sort of is the burnout question. I think the question of how to engage with health systems, I would say the most successful efforts I've seen at health systems have been started by a single individual or a small group of concerted health professionals who are working together, who are meeting with the C-suites at their health systems and are proposing solutions. And so I would say even if you are one person, find a partner, find 2, start a committee, and start talking to your leadership at your hospital and tell them what the issues are that you see and what kind of changes you want. What more can we do? You know, I think that every health system, every school is at a very different place with this. And I think we have this huge opportunity to learn from each other, to learn from successes, to identify challenges. And I think most of all, we really need community engagement. And we are a community here, but even thinking about the communities around us that we interact with and how we can bring each other closer to that. So I'll just stop there.
Great, thank you. Alex, over to you.
Yeah, very quickly. I'm a Christian, actually, and so as a practicing Christian, my faith is important to me, and that's one sort of solace, I guess you could say. It's not a kind of sweet by and by, I'll be raptured, and all this stuff will be, who cares about the rest? It's actually a much more, I believe, centered in kind of a belief in a God who cares for us and has better plans, and even though we can't always discern or fully understand what those plans are. So that's a little bit it, but if that's not your thing, or if you come from a different faith tradition, I've also gotten a lot of inspiration from a fellow named Jem Bendall, who's a British writer on sustainability issues, and he started a whole movement called deep adaptation. So if you want to just Google deep adaptation, you'll be able to find some resources there. The talk about living meaningful lives in face of what seem like impossible circumstances, and the importance of things like community and like not isolating yourself, but actually joining in with others and kind of, not focusing excessively on kind of nihilistic projections of what the world might happen to the world or might not happen to the world. We don't fully know as well what the future holds. So I hope that helps. The whole groundswell does not take into account labor migration per se, but happy to talk offline about some other efforts that have done that. Thank you.
Very briefly to you, Julia.
Okay. I am also from South Sudan, and the past 4 years, South Sudan has seen extreme flooding. I'm from Bar Ghazal, and in northern Bar Ghazal, there's a natural flooding that happens 6 months of the year. The population migrates in response, but there's been extreme flooding in the west part of the country, and there's some sort of response. So what we are seeing is that South Sudanese begin to talk about climate change as a topic of conversation, but then layer that on all the other priorities we have to deal with. We're trying to disarm and demobilize militias. We're trying to feed the population. We're trying to build a health system. There's a whole laundry list of things to do. So when you talk about how do you have the political will and the governance structures to address something like climate change, not just in a country like South Sudan, but other countries, it becomes difficult because we have to prioritize, and it ends up being at the bottom of the list, and not just in developing countries. I would say also in the developed world, where climate change is not necessarily being given the urgency it needs. So I think for sub-Saharan Africa specifically, there is a lack of resources. I think if there was money to address adaptation and mitigation, then there would naturally follow agencies, organizations, etc., focusing on the issue. There is not enough financing going to the developing world to mitigate and adapt to climate change. There have been many promises, there have been many resolutions, but there hasn't been much action. So I would say the first thing is to increase the amount of resources. I think young people are more politically engaged or engaged on this particular issue. I think it's the same case in the low in low and middle income countries, and so continuous engagement on that front is going to be quite important as well. And for the humanitarian sector, I think even for the humanitarian sector, if there was funding, a huge pool of funding for climate change adaptation, mitigation, etc., then you would see organizations prioritizing this as an area of work and focus. I don't know if that answers the question. That's a very, very difficult question.
They were all incredibly difficult questions. I really want to thank our panelists for sharing their thoughts, reflections, and taking the time to be